Welcome. Like many of us, I've spent time at home getting through this pandemic as well as I can. I also sometimes feel frightened, a bit lost, and helpless to control what's going on. And I've decided to share some of my thoughts with you in the vain hope that somehow I might make a real difference somewhere and save lives. My name is Neville Eden. I live in Abergele now in North Wales, and I celebrated my 60th birthday at the end of March in lockdown. I'd previously had a big party organised but had to cancel all of that, and it was a strange feeling. I'm an engineer by background and education, and I worked for over 20 years for AstraZeneca, the company now doing fantastic work to support the efforts to increase testing capacity to discover and develop vaccines and medicines to combat this awful virus. And of course, many other companies and organisations are striving for those things too. I've got significant experience in risk management and preparing for emergencies. And in 2006 2007, I was the UK coordinator for pandemic planning in the UK for AstraZeneca. I don't claim to be an expert, but equally, I'm not a novice. I now run my own consultancy business, Eden Integrity Associates, from my home in North Wales, and do some technical stuff and also people development and group work that I really enjoy. So, this is what I'm going to talk about in about 20 minutes. I'm going to share my view on how we kind of got started in our response. I'm going to touch on what I see as the main positives so far in what's been achieved. I'm going to touch on what I see as the really big risks from where we are now. I'll say a few words about the UK government's 5 tests that they now show us each day on the daily briefing. I want to say a few things about the importance of contact tracing, and then I have some closing remarks about a few things that I really believe we need to focus on as we go forward through this. So, how did we start? The first case of what we now call COVID-19 was reported in Wuhan in China in December last year. China informed the World Health Organization on the 31st of December 2019 that they had a cluster of unusual pneumonia type infections. A global public health emergency was declared by the World Health Organization on the 30th of January 2020. The golden rule of emergency response is to initiate plans early. Don't delay. Don't think, oh, I'm not sure we should start yet. Just hit the button and get on with executing the plans that you should already have in place. So my view is that our government was too late, was slow to take decisive action. We watched harrowing footage as Italy's health service was under severe pressure. It was inevitable that we would suffer a similar fate, but still we did not lock down. We could have responded, in my view, at least 2 to 3 weeks earlier. Secondly, when we did start to get going, I believe that we were too slow. We weren't fast enough. Companies, sports organisations, other organisations were taking action to cancel things, to send people home well before the government did. We all know about the issues with PPE and testing capacity. We were slow to start getting those things that we knew were going to be critical, to start getting those things ramped up. And then Finally, about were we well prepared enough? The reason I was involved in the UK pandemic response in 2006 2007 was because it has long been recognised that pandemic is the biggest risk our country faces. It was formally included in the UK risk register in 2008 and was classed as a high likelihood and high impact event. It's been our biggest national risk on the UK risk register ever since. In 2016, there was a major exercise to test the UK's preparedness. It's believed there were very significant issues highlighted in that exercise. However, the government have refused to publish the learnings and action plans, and it is widely believed that not enough action was taken, particularly with regard to PPE stocks and availability. We can't change those things now, but it's important that we learn from them in future. And I'd like to say, therefore, a few things about the things that we can recognise and be thankful for and grateful for. Many of us applaud on our doorsteps on Thursday nights to recognise the efforts of our NHS and key workers. It's essential that our NHS can cope, and so far, thankfully, it has, albeit at the expense of cancelling some other important operations and activities, which hopefully we can get back to as soon as possible. Secondly, the Chancellor has taken absolutely unprecedented steps to make funding available to support individuals and businesses so far. I know some people still haven't got enough, some people can't access all of those arrangements, but I think we should still recognise the absolutely enormous efforts that have been made to try to help our economy. Thankfully, again, the critical supply chains are still working. I'm highlighting food here, but our lights are still on. We still have critical infrastructure available to us to continue as far as we can our daily lives, and it's essential that those supply chains continue to function. We've ramped up testing capacity enormously. I've already commented that we weren't prepared enough and we were too slow getting going, but testing capacity now is certainly a lot higher than it was, and I believe it is still increasing. Capacity is still increasing. So that is something to be thankful for and something that I hope we continue to grow and maintain. It's been brilliant that I think 99.9% of people have really got behind the lockdown. In my own community here, there's great adherence to the social distancing. Our supermarket's done a fantastic job. People are behaving responsibly, and people are suffering hardship. People have given up things that they want to do, that they enjoy doing, that they love doing, but there's been great public support, and that's absolutely fantastic, and long may it continue. And then I believe that we can confidently say that we are past the first peak. I hope we don't get another one, but I've deliberately included the first peak because we may get another one. It's great that we're past that peak, but I just think we now need to be measured in how we respond. So that's where I want to turn to what I believe are the really big risks right now. First of all, just like we were too late really getting going, the biggest risk as I see it right now is relaxing measures too early. Other European countries had tighter lockdowns and are only just starting to relax some limited restrictions. Spain, for example, I think it was only last week when they were allowing people outside of their homes to exercise. We have not been stopped from going out for daily exercise at all. So we weren't locked down as far as some other countries, and yet we're considering coming out of lockdown not long after them. Um, I understand that we're about 3 weeks behind Italy. We should be patient and not relax things too early. Um, when we do start relaxing restrictions, I think there's a massive risk that we do things too quickly, that we try to return to normal too quickly. We need to go slowly and steadily. It will take 2 to 3 weeks after we make a change in our arrangements for us to see the effects of that change in the daily new infection numbers. And by the time we see the change that it has made, there's a whole backlog of infected people still not yet with symptoms. So we really do need to take things one slow step at a time to try and see the effects of what we've done, to learn quickly, and then to make appropriate adjustments, which might mean taking a step back. And then on adequate measures, I'm not confident that we've got adequate measures in place yet to prevent a second peak. There's the whole issues of PPE, testing, contact tracing, how we continue to maintain social distancing, how we do that effectively in schools, in workplaces, on public transport, in parks, beaches, etc. The use of masks in public. I believe we need to be far better prepared to relax restrictions, certainly far better prepared than we were going into lockdown. We need to be really well prepared before we take the next steps. I said I'd say a few words about the government's 5 tests for adjusting lockdown, and you'll have seen these before. Overall, as a set, my two main concerns and comments about these are they're not very specific, they're a bit vague and not really measurable. So, what is a sustained and consistent fall in daily deaths? How big a fall? They're also two interlinked and not really independent metrics. So some of them rely on the other measures, and I think that's a bit messy and a bit unfortunate. And I think we could have done better in having some more specific measurable steps. And I'll just walk through them briefly. So I think we've got sufficient capacity. We certainly have had so far. So as long as we can keep any second peak below where we've been so far, then we should be able to do that. Sustained and consistent fall in daily deaths. Well, I think we are seeing certainly a sustained fall in daily deaths, and each day I think it is falling. So perhaps we are meeting that test. Reliable data to show that the rate of infection is decreasing to manageable levels across the board. Well, this I think is talking about the R number that we've had various attempts at explaining. I'm not really sure exactly how they're measuring it or exactly what the number is. And I know we can't put an exact figure on it, but I'm really not confident that we've got a good measure, reliable measure, to be able to know that the rate of infection really is decreasing. Operational challenges including testing and PPE in hand with supply able to meet future demand. I think there are still some challenges there. Reports I don't think have entirely gone away about shortages of PPE in the NHS and particularly in care homes. And I don't know whether we've got supply able to meet future demand, particularly if we make different decisions about use of PPE in public. And then finally, I don't really know how we'd be confident that any adjustments to the current measures will not risk a second peak of infections. And then this part that says that overwhelms the NHS, that part of the sentence was added later, um, which I think is an understandable addition, um, but I don't know how we can be confident because of this 2 to 3 week lag between us making a change and being able to see the effect of that change in the patterns of infection and the numbers of cases. And then I think it's lacking saying something in these 5 tests about whether or not we've got contact tracing in place and whether that's up and ready and good enough for us to move forward. So let me say a few words about contact tracing. It's got to be rapid. It's essential that we identify cases as quickly and as early as possible, and then quickly identify everyone that may be at risk from having close contact with that person that has been flagged. It's got to be effective. Any system or app has got to be effective in identifying who has been close to an infected individual. And to be effective, it's got to be reliable. It's got to be tested, which I know we're doing on the Isle of Wight at the moment with the government's first attempt at that. It's got to be integrated with testing. So the system's got to be fully integrated with rapid access to testing so that we quickly isolate positive cases, but also allow non-infected individuals to continue with their work or with their other activities. We don't really want to be taking people out of society circulation unnecessarily, but we've got to take other people out as quickly as possible. It's got to be trusted. Contact tracing has got to be trusted. There's a lot of concern about why our government is going it alone and not building on the solutions developed by Apple and Google that most, I think, other European countries are going down that route. There's speculation that the government will misuse the data that they collect about us. The Apple Google solution is apparently far less invasive, keeps most data on each person's device rather than sharing it, and it does not collect mass data in a central database. So I hope our government can rethink its approach in order to maximise the trust in society. And it must gain trust in the app, because my final point is it's got to be widely used. I understand that at least 60% of us need to use it in order for it to be effective. Finally, a few closing remarks from me. Thanks very much for listening to what I've had to say. I believe that we need to delay coming out of lockdown, get the new case rate down well below 1,000 per day at least, and get fully and properly geared up for contact tracing, testing, isolation, and case management, and properly geared up for arrangements to reopen workplaces, etc. We're going to need to learn lessons quickly. Things will never be perfect. Mistakes will happen. New data will arise. We need to accept that, learn quickly, change what we're doing, implement new actions, and learn and learn and learn again rapidly. We need much more honesty from government and media. If we miss a target, tell us. We're adults. As long as we properly learn and improve, that's the main thing. We can all see that our fatality count is devastating and is probably, yes, probably going to be the worst in Europe. Let's just acknowledge that. We can't change what's happened. Accept we're not where we really want to be. And don't try to defend the obvious reality. Be honest and let's move on. Finally, this is a human tragedy of unprecedented scale and reach across our planet and across all sectors of our societies. And we need our humanity to thrive, to get us through this. We need to really dig deep for each other and our communities and further grow the fantastic spirit that is evidently there in us all. Care for and look after everyone we possibly can. More compassion, more care, and more support for each other. Thank you very much for listening. Just look after yourselves, and then when you're looking after yourself, gives you the capacity to look after others in your communities. And if every single one of us does that and does the sensible things, we will get through this together and we will see a brighter future ahead. Thank you very much. Goodbye.